Hi everybody, my name is Romeo Bhatia. I am in MSN 597. I go to clinical site Golden State Care in Merced, California, and it's a family practice. Um, this is a soap note on carpal tunnel. ID is JD, date of birth 1/1/2000, 34-year-old male, African American male, and his CC chief complaint is numbness, stabbing pain, and discomfort in the right wrist and hand for 2 months. HPI JD, 34-year-old African American male. He is suffering from numbness and tingling and pain in his right hand and wrist for about 2 months. JD mentioned that his symptoms get worse at night after he finishes his job sessions um, as an accountant at his work, which requires the computer use. And he endures the it hurts from his wrist to his thumb, index, and middle finger. He complained that he doesn't feel any trauma, swelling, or weakness in his hand or wrist. He complained symptoms are affecting his work. Previous medical history of hypertension, no surgical history. Family history of mother, 41, diagnosed with diabetes type 2. Father, he is 50, history of hypertension and high cholesterol. His siblings are normal. No history of neurological or autoimmune disorder in the family. If we talk about review of system and talking about general symptoms, denies any fever, chill, night sweats, or weight loss. Cardiovascular or peripheral, nose, chest pain, heart palpitations, leg swellings, and respiratory, no cough, shortness of breath. Neurologically, denies any headache, syncope, but complaining of numbness and tingling in the right hand. Musculoskeletal position, experiencing numbness and tingling in the right wrist. His vital signs are blood pressure of 130/85, pulse of 78, respiratory rate of 16, and temperature of 37 degrees Celsius, and he's complaining of pain 5 out of 10. He weighs 200 pounds, height is 75 inches, and BMI is 24.9. We talk about the physical exam. Generally, patient is alert, oriented, in excellent condition, able to answer all questions appropriately. Cardiovascular, no palpitation, murmurs, or gallops. S1 and S2 heard on auscultation. Respiratory, lung sound clear on auscultation. No nasal flaring, no wheezing, no crackles. Musculoskeletal, patient right wrist is hurting on the inner side. Results of Fallon's and tensile test are positive. And on the pressure, the medial nerve causes tingling on the hand, and 10 minutes later sustained wrist flexing lead to tingling sensation as well. Neurological sensation of the light touch and pain is back in both upper and lower extremity. Deep tendon reflex is 2 plus in both upper and lower extremity. No muscle weakness in the extremity, and no affected reflexes in both upper and lower extremities. So if we talk about the differential diagnosis can be a carpal tunnel syndrome, peripheral neuropathy, cervical radiculopathy, and Duchenne tenosynovitis. For diagnosis, I used up-to-date resources on extended follow-up of local steroid injection for carpal tunnel syndrome. These resources serve as a data sources on typical carpal tunnel syndrome. Symptoms, which are numbness, tingling, and pain in the medial nerve. They also discuss the significant role of Tensel's and Fallon's test in establishing the diagnosis. Cervical radiculopathy is not likely except if there are symptoms in upper extremities like weakness, sensory deficit, or reflex changes, which is rare. Lastly, the lack of swelling or tenderness around the tendon sheath. Rule out D. Cuvarian tensonovirus. Patient symptom leads to assume that neuropathy is not concluded or nephropathy is widespread, not widespread. So final diagnosis is a carpal tunnel syndrome. The diagnostic testing wise, we can do the X-ray or the ultrasound. After we can follow with the treatment plan, like on the first admission, like this visit, we can start the conservative measures management. like wearing a wrist splint, especially at night, rearranging the ergonomics at work, use of pain relief over the counter, NSAIDs like ibuprofen 200 milligram, take 2 tablets every 6 to 8 hours as needed for pain. And if the symptoms still persist after 6 to 8 weeks of conservative treatment, pain management, then the next option will be injecting the corticosteroids. And if that doesn't even relieve, then we can refer the patient to the orthopedics or a specialist. Also, it's very important, along with all the conservative measures, also very important to correlate with the work, the HR, to provide the modifications, to provide the frequent breaks, to bring the changes to the ergonomics at his workstation, um, and also educating the patient about the side effect of the medications, especially the ibuprofen. It can lead to ulcers and bleeding. Educate them about stretching and strengthening exercises. Follow up in 4 to 6 weeks. We can also recommend PT and OT. Holistic approach will be including the patient. Enable JD to act as a decision maker and create a healing partnership to make improve outcome. Ensures that he clearly understands the condition, the treatment options, and the rationale behind the proposed plan. Gene Watson caring process, instilling faith and hope, providing the reassurance, creating optimism that he would feel better and his condition has the opportunity to get better and improve his he could gain his functional abilities, and he can have a better quality of life. Thank you.